It's great to be here with my partners in government to make a number of important announcements. Long before the pandemic, we're in the middle of a mental health crisis, an overdose crisis. Then we hit COVID, and then we isolated, and then we shut down, and people were alone, and that morphed even more. And not just the mental health, the substance abuse, falling behind in education, and everything else. And we tried our best, and we learned a lot of lessons from that. But generally speaking, 1 in 20 adults in the U.S. experience severe mental illness, according to the National Alliance on Mental Illness. That's huge. And I always say to everyone, it's okay not to be okay. It's okay to be, I'm just a little crazy, ex the mayor at times. You can be crazy. It's all right. Take a step back, take a deep breath, and you can get through it. And sometimes you just got to listen to people and not speak. And that's hard coming from a bunch of politicians, right? Just listen and see what people need and what they want. It's hard. And it's hard sometimes when you sit there and you got a different threshold than most people, and you can take more pain out of people, but not everyone's built the same. And we have to remember that. So, which is why I'm here with Mayor Sheehan, Sheriff Apple, the Albany County Legislature, to announce a couple of efforts to address these issues. We're announcing 2 joint funding efforts in partnership with the City of Albany. The first is the expansion of ACCORD, Albany County Crisis Official Response Diversion. That started in the hill towns as an experiment to see if we can treat things differently, free up EMS, free up the police department, and really talk people and say, do you need, is this a police issue, is this an EMS issue, or is this just a crisis in development? I do want to thank the Albany County Legislature, especially Matt Peter, and everyone that's been involved with this for making this happen. And it turned out to be a huge success, and Sheriff Apple can talk about that in a minute, and Mayor Sheen. But you take that model, you de-escalate a lot of things. The anxiety, when the police show up, it helps them. It frees them up to do the calls that they need to do, the ones they really should be on, and it really gets the help that people need. So I do want to thank everyone that's involved with this, that's making it happen. This initiative, which is for nonviolent emergency calls, are diverted from the Sheriff's Office and police to EMS and to mental health social workers. EMS and social workers. And it's a proven track record. It's worked in New York City, it's worked in our hill towns, and it's something we've been looking at. And again, I want to thank the partnership for getting this all done. Secondly, working with CARES, we will begin another partner to fund an engagement program to direct to indirect with the homeless individuals on the streets to more efficient entry into our systems and find stable housing. So working with CARES, we're going to be out on the streets and we're going to engage the homeless and we're going to say, hey, look, we're going to help you. We're going to get you the help that you need, first and foremost, and we're going to try to get you stable housing because the homeless has become an epidemic. And I've said this before, as we talk about migrants and we talk about taking care of people coming here, and we want to do that. Albany County's rolled up their sleeves more than any county in upstate New York, outside the city. But we also have to take care of our own people, too, that are in our shelters. We have 129 kids under the age of 18 living in shelters today. We have over 700 women living in shelters with their children. We need to address this. And we have a homeless problem going on, not just here in Albany County, but across this country. And we have to think outside the box. We have to roll up our sleeves and do what's right for the people that we represent and for our community, for the people that call this their lives, and for quality of life, that want to live here and raise their families or work here or start their businesses here. So again, in a partnership with everyone behind me, but especially Mayor Sheen, Sheriff Apple, and the legislature, and our mental health and CARES and everyone else, and there's probably agencies I'm leaving out that do extraordinary things every day. Thank you. Thank you, thank you, thank you. But we need to do better. We need to do better, and we need to set the model for across the country of how things can be treated and treated differently for a different outcome.
We are standing here today, and I think we're not just a model for the state, but a model for the country. We know that we have a serious mental health crisis in our community. We have a crisis with substance use and abuse. We have a crisis with homelessness. And we have individuals in our community living on our streets who need our help. They desperately need our help. They are individuals for whom the normal pathways that we think are available, whether that be healthcare, whether that be emergency care, whether that be rapid rehousing, homeless prevention, have not worked. And they are in our community, and they are suffering. And we also have residents and businesses and people coming into our city who are frustrated. They're even angry because they see this and it is impacting their businesses. It is impacting how people feel in our city. It is impacting the sense of safety that parents have when they bring their children to our parks and they find needles in those parks, when they walk out to their cars and find needles in parking lots. And so we have this combination of suffering that is occurring and of a quality of life in our community that is just simply unacceptable. Nobody should have to experience that anywhere. And it is happening all across our country. And so as a mayor who is very active in the U.S. Conference of Mayors, I joined a few other mayors who went to Washington to make sure that Congress knew that this is the number one issue that we are facing across this country. Mayors stand united. Red states, blue states, Democratic mayors, Republican mayors, it doesn't matter. We have people who are suffering in our communities, and the current systems aren't working. And then I also have the benefit of being part of the leadership team at the U.S. Conference of Mayors, and we spent 2 days talking about this issue. And one of the things that I walked away with was a real sense of pride, because in the city of Albany and in the county of Albany, while it's important that the county executive and I make sure that Washington knows what we need them to do, we don't wait. We don't wait for Washington, because our community and the individuals who are suffering and our neighborhoods need help now. And we have worked together to get a better understanding of what this issue is, and I have to give a huge shout out to Dr. Giordano and to his entire team. The Albany County Department of Mental Health is they're an exemplar, not just in this state, but in this country. And we have worked side by side and determined that we can't wait. Yes, we need more beds. Yes, we need more housing options. Yes, we need more options from a healthcare standpoint for where people can be and where they can stay, but we can't wait. We need to make sure that there are case managers and clinicians who are able to go to where people are. Some of them, it may take months to convince them to go to shelter or to treatment, and we need to treat them where they are. And so that is what we are supporting today. That is what the city is working with the county to fund today. We didn't want the money from Washington. We wanted the county to get the money that they needed. We didn't want to set up our own clinical program. That makes no sense, because the expertise resides right here in Albany County and in the incredible services that our county executive leads day in and day out, and in the community-based organizations that already contract with the county to deliver these services. We just wanted a seat at the table. And so I am grateful that the city will have a seat at this table, from our police department, who sees this every day, our fire department, our EMS, the people who are responding to calls for overdoses and individuals who are experiencing crisis, my office, and our neighborhood services department, for us to be able to sit at the table so that we can make sure that we're sharing our data, sharing what we're seeing, sharing where we're seeing challenging areas, sharing where we're seeing people who, let's face it, those who are living unsheltered, they are among the highest percentage of our crime victims. They're individuals who are often victimized. And so we need to make sure that the city and the county are sharing the same data, seeing the same things, understanding where those issues are, so that we can reset the norms for our city. And so we're really excited about this street treatment program. We're allocating $300,000 of our opioid recovery money every year for the next 3 years. That's just our initial commitment. And we're going to be looking to expand this, because we have every reason to believe that this is going to be successful, because we are working in partnership with Albany County. We're doing this together.
Back in 2020-ish, late-ish 2020, Matt Peter reached out and said, hey, I got an idea. What do you think about teaming up with some medics and law enforcement and mental health and seeing if we can tackle some of the issues out on our streets? And so we did it. And initially we got a lot of blowback. Everybody was like, oh my gosh, this is part of the defund the police and everything else. And we never did that. Actually, my budget's gone up and probably will this year too. Just heads up, Dan. And
We'll talk.
and so we got out there, and to date, we kicked it off in 2021, and to date, we have handled roughly 350 calls. And those are just the calls involving Dr. G's mental health staff and my medics. There's been several others where we've handled regarding that and have referred over to a court. But some of those calls that we've handled were calls that could have gone bad, probably should have gone bad, but one individual was terrorizing his neighborhood for weeks and weeks on end. He ended up escalating into barricading himself in his house, threatening to do violence to police who came. He basically wanted suicide by cop. And we had a cord. We had our deputies and our medics there. We spoke to him. We got him the treatment that he needed, and now he's living in the community, waving and happy as can be. He had onset dementia, and he needed medication. So some of these folks, it's just a minor tweak that we got to help them with and get and receive, and they're us. You know, I mean, these are our neighbors, our families, our friends, our coworkers, our loved ones, and they deserve that care. It's just, it was a shift in law enforcement. It was a shift more towards, I always say that, you know, the protecting is easy. It's the serving that we always struggle with, and that's what we've had to focus on here in the county.
Again, we need to look at things, break them in silos, but break it down. And one of the great announcements today is the lead law enforcement assistant diversion. And I remember being at Henry Johnson's with the mayor ceremony we had, the sheriff, I believe Senator President at the time, and everyone else. We did a sign-in ceremony, and we tried a new program. It took off in other places around the country, and we hit hiccups. We hit roadblocks. It didn't work out as well as we first wanted to in the beginning. But again, what we're doing is not working. So what do? We didn't throw it out. We re-engaged, we rebuilt, we redid it. So today I'm glad to announce, with the support of the Albany County Legislature, we are going to be investing more money into LEAD funding on top of what we have there already. So thank you, LEAD. Thank you to the organizations and to everyone that's getting it done. And you know, this LEAD organization has worked, and we just need to educate and redirect, and you're going to see different expansions with that going on. But finally, one of the other announcements that we're in collaboration with the Interfaith Partnership for the Homeless, the Mercy House Homeless Shelters. We had 8 shelters, primarily all in the city of Albany, as the mayor already says, you know, 1 outside the city, and 3 of them shut down, or 2 of them shut down. And we got another one that's for sale that's shutting down eventually when it sells. It's an issue. This is a huge, huge issue. So one of the things we have to do, as I say, when I was just out in Turning Stone with New York State Association of Counties, and we had a huge press conference. I go, yeah, migrant issue is just one issue that we deal as county executives in the legislature and the mayors and the sheriffs and everyone else. Multiple things are going on, and we have to address all of this. But with Interfaith Partnership has committed to getting these critical needed shelter beds back online in preparation for the cold blue season coming this winter. This comes at a time, like I was saying, our housing and homeless has significantly increased over the last couple of years because of COVID. And again, we can't get it done without a partnership.
I can't applaud you enough for doing what you're doing. The people behind me, the people in front of me, and as a former longtime vice president of the Interfaith Partnership, I have a special pride, and I'm not surprised that they're right in the middle of it. And I've always said, a good elected official is a great social worker, because he provides for people who don't have the ability to provide for themselves. And we're taking a couple agencies who have proved themselves and expanding what they do, and you're putting the money out there to make sure it's a success. And it makes us all a better people. And to the county executive and the mayor, we all ought to applaud them right now. they've created a model that lots of cities will be coming to find out how they can properly replicate it. And I applaud everyone who participated.
This is something I feel like as if I can't go to the grocery store these days without hearing about. I live here in Albany, although I represent as well Guilderland and New Scotland. This is an issue we hear about here every time I travel elsewhere. Every conversation I have with the chancellor, I'm the new higher education chair, every conversation I have with the SUNY chancellor, it involves a conversation about mental health. And how we address this in a systemic fashion throughout that system. So this is needed. The Accord is creative. LEAD, I was a pretty new legislator when I first heard about LEAD, and it made so much sense, but we are still catching up. Law enforcement assisted diversion. It is about diversion. I was incredibly proud to sponsor the statewide legislation, which we did pass with Senator Breslin's help, with John McDonnell's help a number of years ago, which has allowed it to be replicated, but we need more funding. And so all jokes aside, always happy to continue to fight for the funding on these issues because the need is escalating, not going away. So thank you again for the leadership and the innovativeness. Thank you.
First of all, Danny, I really want to thank you for the work that you have done. You've been around a long time, right along with me. A lot of people don't think so, but he has been. And I can always have faith in the fact that you are going to find different ways to ensure that all of the citizens of Albany County, that everyone's needs are met. Just last week, on a Sunday, I was getting ready to go to church, and I got a phone call. You need to come up to the bus stop. So-and-so is up here, and she's with someone. I can't get her to go. I can't wake her up. And I jumped in my car, and I went up the street, and there was this individual who I know very well, who had taken too many narcotics. And as our aunt stood there crying, not knowing what to do, I realized, too, I had come to a point where I didn't know what to do either anymore. And so you have someone, last month I went to a drop house to try to pull somebody out too. So it's people that's suffering from this addiction and also have these mental health crises that we go through that shows just how terrific the need is in our county and in our city for services that need to be provided.
I think too often as politicians or policy makers, we try to create the next big silver bullet. And as CARES has repeatedly told me, and Dr. G has repeatedly told me, there is no silver bullet. Sometimes it's doing something innovative, and I believe Accord is innovative. But sometimes it's just fixing where there's holes or funding gaps to allow experts to do what they know needs to be done. And that's what these announcements really are. It's about CARES being able to, on the ground, go offer resources to people who may not know what they need, and also increase our ability to match them with services they're eligible for. It's providing resources so that as many people who want to go to mental health court, we have the resources to get them through, because we know that treatment is a better alternative than jail. It's with working with our partners in law enforcement who, as the sheriff and our chief and deputy chief say at APD, law enforcement should be the last resort. First, we should be looking at treatment. We should be looking at housing. But we can't do that if there is not enough housing. And I think that's what we have to commit to. And certainly the reopening at Mercy House with the beds and the shelter beds is a key investment in that. And I think this is just a small investment of what we're doing.
I know we put a lot of information out there, but again, I do want to thank all of our partners that are here in the room. Again, thank you. Not possible without any of you. And again, my partnership with Mayor Sheen. You know, we can get things done just rolling up our sleeves and figuring it out. Same thing with our state delegation assembly and our sheriff and our Albany PD and Albany Fire Department and our legislators. And I got to say, I put Matt on the spot, Matt Miller and Lynn Lakakis, and it was the quietest they've ever been. I'm like, I wish you'd do that when you weren't beating me up over the budget. But I do want to say thank you, and to Sue Rizzo, our extraordinary controller, It takes everyone to get things done. We don't do it alone. And just remember that the same thing with this mental health crisis and addiction crisis. Everyone needs a shoulder. Everyone needs help. I don't care who the hell you are. Everyone needs somebody. Listen, take the time. Help your friend. Help your coworker. Help the person on the street if you can. And it's okay not to be okay.